impact of COVID-19 on the neuromuscular diseases and care of these patients with neuromuscular diseases. There are several levels of impact because of the pandemic and the social guidelines that was out there. We had to restrict our practices, and these patients have to follow the state-specific, the national-specific, and also the institution-specific guidelines during this COVID-19 to avoid the exposure or to minimize the risk of getting COVID-19, as some of these patients with neuromuscular diseases are at increased risk of having severe infections. There was some information presented on the patient-focused survey on impact of COVID-19 on these neuromuscular diseases. It was interesting to see that most of these patients reported that there was a moderate level of impact on their care. There was also information about how stress coping strategies was able to help them to navigate through this pandemic. Another important aspect that was discussed include the telemedicine. Historically, in the neurology or in the neuromuscular world, telemedicine did not have a lot of role. However, this pandemic has taught us a lot about telemedicine. There were both positive and negative things about telemedicine. Most patients prefer telemedicine for their follow-up visits because of its ease of use, and they don't have to travel many hours to seek care from these tertiary care centers. On the flip side, there are also challenges with telemedicine. In some of the rural states, there may not be access to internet or computers, and it is difficult for these families to get on to do these telemedicine visits. I think we have learned a lot from this pandemic in terms of utilizing telemedicine in the neuromuscular world, including stable follow-up visits and also some physical therapy assessments and continued therapies with telemedicine. I think this information is very helpful moving forward to utilize in our neuromuscular care for these patients and families with neuromuscular disorders.